provide personalized counseling. So we don't do the counseling in a Zoom, but individually. And we're impartial because CMS, or the Center for Medicare and Medicaid Services, trains us to give us the information on what is available so that we can share that with you. So we're not selling or soliciting for any particular insurance company, just what is covered under Medicare. We do this education and outreach through presentations. We have counseling stations, which are now closed, but will open soon, I've been told, through health and benefit fairs, and through community partnerships like you guys, where you give the information to other individuals. Okay, so the Part A of Medicare, I'm going to explain it like there's some people here that don't know Medicare and don't have it. Okay, so the Part A of Medicare is the hospital coverage portion, and it usually is free of charge if you have worked for 10 years or have paid your FICA taxes. The Part B is the medical portion, and it's for the doctors, certain medications, durable medical equipment, therapies, and that sort of thing. It does have a premium, and that premium currently is $148.60 a month if you have an income of $88,000 or less. If your income is higher than that, your premium is higher than that. The Part D is the prescription portion, and you must have the Part D of Medicare in order to help offset the cost of your medications. And if some of you have seen the retail cost of these medications, absolutely ridiculous. That Harvoni, that was for the hepatitis C, and you saw the commercial where they said, if you have hepatitis C, the baby boomers might have it, so, get tested. When it first came out in 2016, the copay was $93,000 a month. They now have a generic form and competition, so it's dropped down, but it is still currently $23,000 a month. And their excuse is that they do have to pay back researchers, it cures, so you don't have to take it for life, just for about a year and a half. And they need to recoup their costs. So that's why they're doing it. Okay, so President Biden signed 40 executive orders in January, and the treatment of COVID was among those. So some of the extras that we got through those orders are expanded telehealth services, greater access to and control over your electronic medical records. And if you recall, if you wanted something from your record, you had to pay for it and you had to have authorization slip signed. But now they're mostly electronic and they're on the computer. You can get them. You have free access to it, and you can make free copies, and you can take them to other doctors or other plans, or just go over it yourself to see what's in your record. The state is required to share enrollee data when you are duly enrolled. So if you have Medicaid or Medicare savings program, they're supposed to share that with Social Security and IRS. They had not been doing that. And so you were not getting all of the cost sharings or savings that you should have been receiving. Ambulances can transport you to the primary care physician and to urgent care. The waivers allow for different destinations. So any location that can provide treatment consistent to Medicare guidelines or emergency room protocols, you can be transported to. All of this is in case you have waived or you've been exposed to COVID, okay? And there's a proposal to have insulin no more than $35. Insulin is very expensive. That executive order was signed by President Trump, and the insulin that came in at the time was from Canada and China. And the cheaper medications. So if you are in a plan or if you are receiving some of this cheaper medication, Check to make sure it did not come from Canada or China, because they don't have the same regulations as we do here with the FDA, okay? There are lower deductibles in the plans now, and there's a shrinking coverage gap. Now, if anyone has had expensive medications like that Harvoni, you understand about the coverage gap, and very glad to get a shrinking one. Now, there have been changes in therapy caps. So before, when you were getting therapy, some people couldn't even get therapy because they were told you're not going to improve, so you don't qualify for therapy, or you're not improving, so we're disenrolling you from therapy. Well, it's no longer primarily health related. As long as you can maintain your functioning and or mood, and that is very important because mood did not matter to them before. So as long as it can maintain your mood and reduce avoidable emergency room visits, you can continue your therapy. Now, you do have to have the plan of care in place, but you can continue it. Persons with end-stage renal disease can now enroll in a Medicare Advantage plan, a special needs plan. Before, they could not get an Advantage plan. If they were in one and were allowed to keep it, they could keep it. But if not, they could not enroll in one. They had to have original Medicare. The health market plans must send a notice before the individual turns 65, suggesting when to enroll in Medicare and what happens with that health market insurance if you decide to keep it. They had not been telling people and letting them decide to stay with it. Some people's plan was like $17 a month. And then they said, well, I'm not enrolling in Medicare, pay $150 when I could pay $17. But what they didn't know is that you don't get your subsidies if you're Medicare eligible. So then their plan jumped from $17 to $400+. And then they're like, what? And sometimes they could not enroll in Medicare because they waited to the last minute and they had missed their enrollment period. So now the health market is required to send out that information. Your 3-day qualifying hospital stays have been waived. So you can go straight to a rehabilitation facility. And that is great. We'll discuss that more a little later. Home health care and hospice can get telehealth approval, and most of the paperwork has been waived. There are 432 variables that are being considered. Okay, those variables are things like timing, admission source, functional impairment level, and comorbidity adjustments. So they look at all of that when they're looking at the home health care services now. Wow. There needs to be a comprehensive plan of care in place, and then you can get the home health care. There needs to be a reasonable expectation to maintain your health and or functioning and psychosocial impact. That's the mood. So if you're inclined to be depressed, become depressed or suicidal, you can keep your therapy. Some of the services that are included in the home health care package are things like adult daycare, in-home support, home-based palliative care, memory fitness, caregiver support. And that's very important because they didn't care about the caregiver before, and there were very few things to have that for them to get. So now there is caregiver support. And there are a couple programs on helping to pay for the care. There are home bathroom safety devices and modifications that you may be eligible for. That's just to name a few. All of that is in the home health care portion of the package. Durable medical equipment. If you have lost, damaged, or destroyed durable medical equipment, it won't need the usual requirements to be replaced. Now, you know, there's some equipment, let's say like a wheelchair, and I know you've seen people with the wheelchairs duct taped and bike tires on them, trying to keep them going until they can get a replacement for the wheelchair. And I think it was 5-year wait before you could get one. Well, that is not the case now. And this is very important. If it is lost, damaged, or destroyed, as long as you have a medical necessity document, your doctor says that you need this equipment, get it. Okay, get it now. They don't have to do the usual assessments, prior authorizations, get all the signatures and have new doctor's orders like they did before. So it's much easier to get, and you can get it even if it has not been the time limit that they set on it before. Now, let me explain telehealth. Telehealth services are a full visit with the provider using a telephone or video technology. Medicare will cover hospital and doctor office visits, mental health counseling, preventative health screenings, and other visits in settings that include your home. Providers can be doctors, nurse practitioners, clinical psychologists, and licensed social workers. Before, they would only pay if it was the doctor, but now, and in most cases, the primary care physician, but now it can be the other professionals as well. Standard cost sharing may apply, but your provider may waive the fee. So a lot of people that's been going to the same doctor long time, they may go on the computer portal and talk to the doctor like we're talking now, okay, and ask the questions and get the answers and not be charged a fee, not be charged an office visit. Now, some are not able to waive the fee because they're attached to something like Emory, and Emory would not allow that. But if it's a private doctor's office, a lot of doctors have been able to waive that fee so that you don't have to pay it. If you have an Advantage plan, you can contact your plan to see what they say about telehealth and portal visits and the cost and the ability to waive the cost. Home healthcare agencies can provide more services via telehealth as long as they are listed in the plan of care. And the face-to-face visit can be met through telehealth, which is wonderful. Now, you've probably seen that there is a bill to amend Title 19. That's the Medicaid Home Community-Based Services Access Act of 2021. And what they're trying to do is get it expanded and get more services and get more money. Currently, Medicaid has funding for nursing home placement. That's mandatory. It will pay for nursing home placement. But home-based care is optional. And what they're trying to do in the expansion of Title 19 is get it so that there is permanent extended funding for home-based care. And we'll see what happens with that. I hope they do vote for that. Okay. Now, covered services. Outpatient care is covered under your Part B. If you are in a bed in the emergency room, it's considered outpatient, even if you stay overnight. And if you have to be transferred to a skilled nursing facility without being admitted due to COVID, you can do that, and they waive that 3-day fee. You can also be admitted from home if, let's say, the hospitals had been crowded with COVID patients and couldn't admit people, but you needed therapy, they would transfer you directly to the skilled nursing facility and it be paid. And that's a big deal because Part A of Medicare covers the first 20 days at 100%. Then day 21 through 100, there is a cost. And the cost it ranges depending upon the insurance that you have from $168 to $188 per day. $188 per day from day 21 to day 100. And that is why most people try to do rehab and get out within a 2-week period, definitely by that 20 days, so they don't have to pay that charge. Well, there is a new waiver, and I am so happy about that. The waiver includes, but is not limited to, beneficiaries who need to be transferred to a skilled nursing facility due to the hospital having issues or the nursing home having issues, as long as the facility has a bed during this pandemic, you can be transferred there. If you use up your 100 days in that benefit period, and you had COVID, your roommate had COVID, the aide had COVID, somehow you were exposed to COVID, and that has been happening, you get your 100 days reset. And I have had that happen. At the end of March, someone called, their mother had been in the facility. Well, they had been in the hospital, went to the facility, was sick, went to the hospital, found out it was COVID, was treated for COVID, went back to the facility, and the facility said, she's out of her 100 days. And that means you have to sign her up as long-term care, and you have to give us her April check. When the check comes next week, you have to give us that April check. I was like, oh no, you do not. And this is what it is.
What are you guys taking upstairs?
Okay, so no, you do not, because she had COVID. So that means her 100 days were reset.
Honey, if you
she
take
started
something
right
upstairs,
back at
put
day
it on a
one
plate or
with the
something.
20 free days. Whether she needed the full 100 or not, she started back with the full 20 days. She got that free to start. Okay. Part B covers services that are received from a provider when they visit your home. It also covers check-in phone calls or assessments during an online patient portal. So a lot of the hospitals have patient portals now that you can do that. Virtual check-ins can be used to assess whether or not you need to go to the doctor or go to the hospital or visit the doctor in person. Okay. If you have a Medicare Advantage plan or Part D plans, the Medicare Advantage plans must allow the beneficiaries to receive health care in an out-of-network doctor's office, hospital, or facility. You know, at the beginning of the pandemic, a lot of people were transferred from their home to a relative's home so that they would not be alone or so that they could receive the care. And most of the time that was out of network for an Advantage plan. And at first, they were charging those out-of-network fees. Well, let me tell you, they have to charge the in-network fees even if you're out of network. They have to waive the referral requirements. They have to suspend their rules requiring that you tell the plan before getting certain kinds of care or prescriptions. If they don't waive the requirement, then that is limiting your access to care, and they cannot do that. Part D has to fill your prescriptions at an out-of-network pharmacy, and they have to fill it at the cost that they would charge you at an in-network pharmacy. And at first, they had not been doing that. So a lot of people had to be reimbursed for the extra money that they spent. But as long as it is the pandemic, that is something that they have to do. We have been getting prescriptions at 90 days, a 90-day fill. So if you are in the third month of the 90 days and you want your medication refilled, again, if you're exposed to COVID or if you had COVID, then you can get the next 90 days refilled. And they can't tell you that it's too soon to refill. Medicare relaxed the policies on permitting mail and home delivery of prescriptions. At first, there were certain things that could be sent. There were plans that did not have mail order and didn't allow it, now everyone has to. And so you can get your things delivered. Medicare will pay for it. They have to waive prior authorization for for certain medications. Now, if they're narcotics, they still have systems in place because they're still fighting opiate addiction. And so they still have to have things in place for those, but other medications can be refilled sooner. Corona testing and vaccine. Part B covers coronavirus testing. The first test is absolutely free, requires no orders. The next test is free, but they would prefer that you have the doctor or practitioner write an order for any additional, your second, third, or fourth test. And I don't know why that is, but that they want orders. There's still no charge for the labs or the provider visits, but they want an order. Part B covers the vaccine. Regardless of whether you have Medicare or an Advantage plan, there is no deductible, no copay, and no insurance. And at first, back, they were charging a copay. So that had to be reimbursed. But absolutely free, whether you have Medicare, a Medicare Advantage plan, or no insurance at all, it is free. The government is paying for it. Medicare covers the monoclonal antibodies to treat COVID-19 at 100%. If you test positive or are being treated for COVID and have comorbidities, ask for a BAM. And I hope you can see the lab name because I mess it up, so I don't even try it anymore. It's called BAM, B-A-M. What they had not been doing was telling people or giving the shot. And let me tell you, if you test positive, request it as soon as possible. And the majority of the people they had not been sharing this information with have been females. All right, if you get this shot, if you get this shot within that 10-day window, you avoid hospitalizations and definitely avoid death. And that was very important and something that they should have been sharing. So I'm letting you know. BAM, B-A-M.
Bam.
Right. Now, when I first did this, this last thing said there are no vaccines. Okay. Then it changed to there possibly will be one, and there's another one right at the door waiting. And then it went to there are 2 vaccines and possibly 3. Well, now there are 3 vaccines. Pfizer and Moderna are approved for 16 and up. Oh yeah, and that was also the other line in here about the frontline workers, and you had to be over 65, and that kept changing. Okay, and there was a medical center in Elberton, Georgia, that lost their ability to give vaccines because they gave out their shots to all of their healthcare workers and they had more vaccine. So they started vaccinating the teachers. That was against Kemp's rules. He didn't approve that. So they went in and took all the vaccine that they had and told them they wouldn't get any more till July and they couldn't give any more shots till July. And I'm thinking, well, what happened to the people that got the first shot? You know, will they get their second shot, especially the healthcare workers that were in the eligibility requirements? And, you know, what's going to happen with that? And then since they changed all the rules, I haven't read anything that, you know, they've apologized and brought the vaccine back. But that's what they did at first when it was only people over 65 and healthcare workers and frontline workers. Johnson & Johnson is good, has been restricted though. So persons 60 and up can get the shot and there haven't been any complications. Most of the complications that they did find with that vaccine were with people under 60. And so they're restricted, they're testing to find out why, and if there was something else, if they had it in common that caused these people to develop blood clots. And then the scams. everything comes with scams. The con artists are out there all the time. Now, this is one of the first scams about calling you and offering you the test kit so you didn't have to get in that long line for the test. The lines are not as long anymore. There are more stations, but still people don't want to leave their home for the test. So they were giving out their Medicare numbers so they could get the test kits and things in the mail, the hand sanitizer and all of that. If someone offers you that, hang up. It is not difficult to get the test now. There are more places that have it, will give it. They'll even, there's stations that will give you the home test so that you can take it back home, but do not do anything over the phone. And the FCC offers the following tips to help prevent you or protect you from scams. Do not respond to calls or texts from unknown numbers or others that appear suspicious. Never share your personal or financial information via email, text messages, or over the phone. Now, I just got something yesterday that showed me a list of 3 emails, and it said, now, what's wrong with this? And so you look at it, and it looks very similar. What was wrong was that the A in the second word, let's see, what was the word? I forgot what the word was, but it was something like email, comma. Okay, well, the second A was not the same. But if you don't look at it closely, you would not have seen it, you would have clicked on it, and you would have been hacked. And so that's what they're doing. If you get a new email, look at it closely, make sure all of the letters are the same. There was a capital A classic A, and a printed A. And that was the difference in them. But if you didn't look at it closely, you glance right over it. Be cautious if you're being pressured to share any information or to make a payment immediately. All right. There are people that have been threatened with being arrested. And some people were saying, well, why would you fall for that? Just last month, a female shared that she was built out of $30,000 because they called her and demanded money, and she sent the money. And they do not do that. Scammers are now spoofing phone numbers to trick you into answering and responding. Before they had strange area codes. Now they have the area codes that are indicative to Georgia. So 404, 706, 678, all of those, and you're thinking it's a legitimate, might be somebody down the street. Remember, government agencies will not call you and pressure you for your personal information or demand money. They love to write letters. I will tell you, they love to write letters, but they will not call and demand anything. If so, hang up. Do not click on any links in a text. If your friend sends you a text with a suspicious link, even with a link, don't click on it. Call the friend. You sent it to me, so you know what it is, so tell me what it is. Well, what is the actual website? And I will write it down, and I will go on Google and I will look it up myself, but don't click on the links anymore. If they don't know, sometimes they have been hacked and someone sent that. It's like, I think February and March, there were a lot of requests for friend me on Facebook and friend me on some other media. And that was a hack that they got in and got your friend's information. And then you click on it and say, okay, and you click on it, and that was not your friend. So now you are with somebody that's overseas somewhere that has hooked into your computer. And we have a lot of stuff on our computer and a lot of way to backdoor into our finances. If you have ever purchased anything online, your information is in there. Just because we don't see it, don't know how to get to it, right? The crooks do. So If anyone calls and says that you have been around or exposed to persons who were positive, and then they ask for your personal information, don't fall for it. They don't do COVID like they did venereal disease and call you so you can be treated. So no, don't fall for that. Don't give them your information. People state they will run errands for you. So that's a big scam. So they take your information and then you never get the product and they never return, okay? They never perform the errand. You know, I will mow your lawn. I will clip your hedges, you know, send me this. Because it's not just your Medicare number, they're also looking for your credit card number and your social security number. Even though Medicare doesn't use the social security number anymore, it is still attached to a lot of things and it can still get people things. So do not share. Now, if you believe that you're having trouble with your Advantage plan or your prescription drug plan, Georgia Cares can help you file that first and second level of appeals or grievances and file a complaint with Medicare. Or you can call Medicare directly, and that would be 1-800-633-4227. If you feel that you're being discharged from the hospital or the rehab too soon, you can contact the Beneficiary and Family Centered Care Quality Improvement Organization, that's a mouthful, which for us is KEPRO, KEPRO. And their phone number is 1-888-317-0751. Now, the FCC, which is the Federal Communications Commission, also known as the Federal Trade Commission, has a phone number 1-888-225-5322. And they have a video chat phone now. So you can call that at 1-844-432-2275. If you have been scammed, if you believe that someone is trying to scam you, if you have the phone numbers or the information that you can share with them, that's even better, because then they will try to shut that down. They will try to enforce and arrest them. Now, there were 3 free credit reports that had been available until April 30th, which was yesterday. So you could have checked your credit at all 3 bureaus from January to April 30th, 3 times. Usually you only got once a year, but you could have checked it because so much was going on that there were a lot of scams and a lot of hackers, and they wanted you to be able to see if someone had tried to do something to your report. I don't know if it's been extended, so you can check with the consumerfinance.gov/coronavirus to see if they have extended that, so you can check your credit report. And then lastly, COVID-19 funeral assistance through FEMA. If you have a family member or a friend that has passed from COVID, FEMA is providing funeral assistance. So it can be applied for online through FEMA.gov/funeral-assistance/FAC. Or you can call 844-684-6333, Monday through Friday from 9 in the morning to 9 at night. The death certificate must say due to COVID or due to complications brought on by COVID. And you can submit the documentation online through disasterassistance.gov or fax it to 855-261-3452 or mail it to COVID-19 Funeral Assistance, Post Office Box 10001, Hatesville, Maryland 20782. And that's it. So if you have any questions, now I will be open for questions, and thank you very much for having me.
Anybody?
No questions?
Really thorough, my God.
Really good.
Well, government's doing quite a bit.
I told you, there's a lot of information, a lot going on, and not all of this is going to stay. Right?
Right. It's just, this is a short-term relief.
Yep. Well, well, I do know that they have the funding until June, till the end of June. So that gives us 2 months to figure out. I was trying to get a lot of this information out for people that had a Medicare Advantage plan. So you could look to see if you had what you needed. And if not, there are 160 new Medicare Advantage plans this year because of all of the waivers. And because they were trying to figure out, they didn't want to give everything in one plan, and they didn't want everything to be free, because, you know, the Medicare Advantage plans are still private insurance. They have a contract with Medicare, so they have to follow Medicare guidelines, but they're still for-profit business. So they were trying to figure that out. There are a lot of plans that have the different things that are for free for you. And like the modifications, let's say respiratory issues, you start out with asthma and you start out getting the medication, and then the inhalers, and then the CPAPs and the breathing machines, and then it moves to bronchitis. So then you get a few more things, and then it moves to COPD, and they say, okay, well then they will approve a HEPA filter. They will approve your carpet being cleaned, all right, to improve the quality of the air in your home for your respiratory issues, and on and on. And as it builds, there are other things that are approved. So see what your plan has, what it includes, and if there are any veterans benefits that also pay for it, because it's still government. And even though it doesn't have the same guidelines as Medicare, it still has some additional funding for some additional items.
Shirley, I have a question. This is Nancy Truelock.
Yes, ma'am.
Can you, I'm not really happy with my Advantage plan. Can you go back to Medicare and a extra supplement once you've gone to an Advantage plan?
Yes, you can.
And I can't do that for 1 year, is that correct?
Well, you can, if you have a Medicare Savings Program or Medicaid, you can do it. Let me see, you can do it January to March, March to June, and June to September. And then after that, you have to wait till for the open enrollment period, and it changes the following year. If you don't have that, you have to wait to open enrollment, let them know that you are not renewing, and then the following year you're back on Medicare. And in that time, look for, you said your supplement, look for your supplement to see what is affordable and what you would like.
Okay, thank you.
You're welcome.
So where can you find a list of things that if you have a respiratory condition, and do you have to go to the doctor and discuss these with him?
You definitely have to. It has to be in your plan of care. That's why I said a comprehensive plan of care, okay? So that he doesn't have to say, well, right now she needs a Spiriva inhaler, you know, but maybe later. No, what he says is that your condition is progressive, aggressive, and he would recommend, or he would want you to have such and such, and then that's in your plan of care so that you can get it.
Okay. Are you going to have this presentation available to us later? Can we pull up these notes or anything? Do you know?
I believe I sent it, but I did
Okay.
modify it yesterday. So I guess I have to send the new one. Okay.
Okay. Thank you.
You're welcome.
I have a
Yes,
question.
ma'am. Miss Maureen.
Yes, I have a question. It was, my husband and I, we both had Medicare and a supplement, and it was
Mhm.
costing us
Mhm,
$600
mhm,
a month, whether we used it or not. Granted, you know, you'd walk in, pay nothing, no bills, no nothing, no.
mhm,
So now we decided we went to a Humana PPO.
mhm,
So now there's nothing up front. You know, we do have to pay $35 per doctor visit, big deal. And, you know, I think the testing, you know, the diagnostic tests, you know, can be a little hefty there. But I did learn if you're planning on having 2 tests, or even if they're 2 different ones,
mhm,
at the same time, because then they hit you only one time for
mhm.
the copay. But so far since January, we've saved a ton of money already doing it this way rather than the other. And when you said here the standard cost of sharing, I mean, is that something that I can go to the doctor and say, you know, to not ask me for the $35, or
That's if you're doing a telehealth
only
visit.
telehealth
That's
medicine?
where they waive it. Mhm.
It is waived.
No, you have to ask your doctor. And if he doesn't know, you have to look at your Humana plan and see if you can get a free one. But usually ask the doctor if he will waive the fee.
Well, what's so nice, Shirley, about this presentation, because I know you have people from all over, is that it's standard throughout the states. All the states have a SHIP program where they can get in touch with somebody like you. But all the
Yes.
information is still standard because it's federal.
Right. The Medicare waivers are standard. The state to state expansion is different.
Thank you.
Okay. So some states have better,
You nailed it.
yeah, better
Nailed
things
it.
available. Like I was totally
Carol?
shocked that Medicaid in the state of Georgia does not cover vision and dental, does not cover your glasses and your dentures. I did, after you're 65, I did not know that. And because I'm from Ohio, and in Ohio it was covered. It was covered, but that is an extension or waiver that is because of the state. It was the governor from the state that said, oh yeah, pay for it. And here they didn't, they don't.
Carol, did you have a question? Carol,
No,
I thought you
yeah.
had your hand up before.
I did
Somebody
before.
Okay, all
I
right.
have a question.
Mhm.
Under
Renata?
under the home health care, you mentioned something about it covers if you want to get like your bathroom or go over bathroom modifications.
Mhm. That has to be in plan of care too.
Plan
The
of care.
doctor has to say, you know, she cannot be stepping six inches over into the bathtub, you know, or she needs to grab bars or whatever modification you want. Mhm.
Yeah. So does that cover something like these step-in tubs that you see on TV, or for people that are disabled? That could possibly,
That could
if your
possibly
doctor's
be covered.
care,
That
be
could possibly be covered because they were saying that for the respiratory, after they start with a little room HEPA filter, if that does not do the trick and they have to have it whole house, they've been putting in whole house units, HEPA units, you know.
So okay, that's one of the things I was worrying about, because I need some stuff done. I have to have some changes done because you can't get in and out of the tub like you used to and stuff like that.
Mm-hmm.
It's expensive.
It's very expensive. So that's why I'm letting you know about it, letting you ask your doctor to get it written and to find out what your plan says about the modifications.
About home.
They might have steps that they want you to take. Instead of modifying your tub, they'll buy you the bench so you can slide over into the tub, or they try to get away with things, but try to have it in your plan of care, and they can't deny you. That's what I want you to know about it.
Called plan of care. Okay.
Miss Grace?
Yes, I had a home health visit by an occupational therapist last week. They went through my whole house to see what kind of improvements they could do. I don't know if it's going to be part, but now I can ask, will this be part of my plan of care? This is really good information so that I can help advocate for what I need: wider doorways. I can't, I can only get so far with my power chair. There's just a lot of different issues we all have, but
right.
So this gives us some good knowledge. Thank you.
You're welcome.
So we have 2 months to do this. Is that right?
Well, I know for a fact there is funding up until then. So I don't know what's going to happen later. I have not seen anything.
One of the things that President was talking about was the changes. The infrastructure bill goes through, and part of the infrastructure was taking care of the elderly. Would that possibly increase a lot of the funding for people who are elderly and have disabilities?
Possibly will increase.
Yeah.
I know that I had the budget, a listing of the budget for 2020 that was written in 2019 and for 2020, and the things that President Trump had asked for, there were a lot of services and programs for seniors that he was cutting the budget for.
Right.
So.
But with Biden, with this new, if this passes, right, possibly even family members could become caregivers, because right, more, with more and more people, especially baby boomers or people our age, wanting to stay in their home. It usually takes a relative or someone that we know that could assist us, and they would be labeled as our caregiver, and probably be possibly, giving them the funds for this, if that goes through.
That's that HCBS Access Act 2021. It's in there.
Yes.
Yeah.
Hopefully it'll go through. Yeah.
I think also it's supposed to include money for more accessibility into businesses who have been grandfathered in, but we cannot get into. I'm sorry, but that's my entire town. I mean, when you live in Montana, it's all, okay. I can't go anywhere. So, so I'm hoping.
I have a question, or a compliment. That was a very fine presentation, Shirley. Really
Thank you.
Appreciate that. Very easy to understand. Do you have a corollary in Florida or other states? How would we?
Yes, it's called Shine.
Now
I don't have it in front of me, but I do have the number somewhere.
Well, Shine.
But it's called Shine.
Okay. And one other observation, Stanley, your ship has sailed.
Great.
We're getting ready to. It looks like he's getting ready to go somewhere.
Okay. If you don't like that ship, I'll give you another one.
Uh-oh, competition.
All right. Well, if there are no more questions, thank you very much for having me.
Thank you so much, Shirley. You're always so great, and this is really informational. I didn't realize the government was giving us all of this at this time. This is fantastic. So anyway.
They're not going to tell you.
Well, I know they're not. Thank you anyway. And thanks a lot.
Oh, you're welcome. Bye-bye.
Okay.
Thank you
Thank
very
you.
much.
Thank you, Shirley. Thank you.
Richard, by the way, if you dial 211, they'll be able to get you to Shine.
Now we're going to have a little presentation by Maureen Sinkel. She's the co-founder of Vaca Area Post-Polio Group from Florida. And she's I thought she'd be a great host, a guest, and because of all the interesting things she's done. And so if you'd welcome her now, we get a little presentation from her. Maureen, are you on?
We can't hear you.
Uh-oh.
She's muted.
Uh-oh.
You have to unmute. Yeah, there you go. You're good.
Okay. So good afternoon, and thank you all for having me. My name is Maureen Sinkel. I was born in 1951 in Bay Ridge, Brooklyn, New York. At the time, I had an older brother, David, who was almost 3. Sadly, I never sat my parents down to get the whole story of my childhood. Here is what I was told and remember about my life. On November 11th, 1953, at the age of 2, my mother noticed I was running a temperature and my neck hurt. Additionally, Grandma noticed I was tripping each time I walked. I was rushed to a hospital by taxi. My brother remembers peeking into the examining room where he witnessed, in his 5-year-old mind, a doctor putting a needle down my throat. I was diagnosed with polio, hospitalized, and my immediate family was quarantined. As much as the doctors told my parents to stay away from me because I was so contagious, they held me even closer. 2 days after I contracted polio was my brother's 5th birthday. He was running around asking, "Where's my party? Where's my party?" Out of sympathy, and despite being under quarantine, one of my great aunts visiting from Egypt walked to the local store and brought back party goods and made a party for him. As a result of me contracting polio, my 3 great aunts had a 3-month delay returning to Egypt and Lebanon because of the epidemic. Grandma was so upset that she cursed God for inflicting me with polio. About a month later, in December, King David, as Grandma lovingly called her firstborn grandson, started exhibiting the same symptoms. So she got down on her hands and knees and said, forgive me. I accept Maureen, not David too." Mom told me that the March of Dimes said that if she gave me to them, they would pay for everything. Her response was, "No one is taking my daughter anywhere." My parents and Mom's sister's family purchased a 2-family home in 1954 that only had 1 step to enter. I started to stutter because my brother always answered first, not giving me a chance. So he was sent to sleepaway camp, giving my stuttering a chance to subside, which it did. For the next year, Mom carried or pushed me in a stroller. One day, an older cousin of Mom's came and said to her, "You can throw me out of your home or tell me to mind my own business. You cannot carry Maureen for the rest of her life. I've made an appointment with the doctor and it's paid for." In late 1955, I started rehabilitation at St. Charles Hospital on Hicks Street in downtown Brooklyn, and was fortunate enough that I was there for a short time receiving PT and had no surgery. Dad took movies of me there during Christmas time when a famous baseball player and TV personality, Officer Joe Bolton, came with gifts and to entertain the children. Most children at St. Charles had polio. Mom told me that I always wanted her to be first in line for visiting, and she did her best to comply despite having my older brother and new baby sister Diane at home. In early 1956, I was discharged to have home physical therapy of leg stretching, which was costly. Since Dad was only making about $80 a month, Mom asked, was taught, and gave me PT at home. As an outpatient at St. Charles, I was fitted with 2 long leg braces made of stainless steel and leather with a waistband. I also used wooden crutches. In addition, I was taught how to sit, stand, fall, get up, and climb stairs using my new braces and crutches. For some reason, still etched in my brain was the daunting full flight of hospital steps I eventually mastered. The physical therapist wanted me to climb up, and I remember saying, I can't. Despite this, I was encouraged until I made it all the way up and down the stairs. Whenever my family went anywhere, I was there, pass, to not wait in line or park wherever we needed. Mom wrote love letters to the police. Little girl on braces and crutches receiving PT or whatever. I must park here. Thank you, Mrs. Naaman. One time she did receive a parking ticket and took me with her to court where the judge said, dismissed. Like Mom, I found myself writing the same notes when I needed to park at the airport or wherever. Dear officer, I'm on braces and crutches. As you can see by my hand controls, I'm picking up my friend at Delta and must park here. Thank you, Maureen. In November 1958, my parents, brother, and I flew complimentary to California as Dad worked for American Airlines. We flew first class and met Charles Lawton and Elsa Lancaster, who befriended us and gave us a ride in their limo to the Hotel Roosevelt in Los Angeles. They gave us a letter addressed to Dear Walt, as in Disney, to take care of their friends. We enjoyed Disneyland and stayed with family friends. When we arrived at the airport, my brother and I had to fly home alone as Mom was hemorrhaging. Little did we know she was 3 months pregnant. Dad followed home after Mom was stable. Someone told Mom that I must go to a special school, and her reply was, why? She doesn't live in a special world. So my parents did everything possible to have me lead a normal, independent life, which included my schooling. I made my first communion on May 16, 1959. Grandpa, being a shoe manufacturer, made my ugly brown high-top shoes white and beautiful. Dad, with the help of my brother, covered my wooden crutches with white contact paper. We had a great celebration, despite the fact that my braces broke. This proved to be the beginning of many more breaks. My baby brother, Bruce, was born safely 5 days later. Sometimes I'd fall in church and Mom would stop people from helping me, saying she can get up all by herself. They thought the worst of her for it. Years later, Mom was approached by those same people. And after seeing me as a young adult, they then understood and applauded her for enabling my independence. In the summer of 1960, I was 8 and was sent to sleepaway camp in New Jersey for children with disabilities. Mom believed in equal opportunity for her children. Surprisingly, we slept in tents 18 inches off the ground. I remember asking for assistance and was told, you can do it. Foolishly, I conceded and fell, fracturing my left arm. Dad rushed to camp and took me to a local hospital where they put a cast on. Now, unable to walk, I spent the rest of the summer at St. Charles Hospital until my cast was removed. While there, I met other children with polio who were rehabbing from various types of surgery, hips, arms, legs, and back. One little boy, Eric, had no limbs, a victim of thalidomide. That fall, Hurricane Donna blew in, and my classmates wrote me letters, which I still have today, all about the downed trees and what they were doing in school. In 1965, I had my first operation, which was a triple arthrodesis on my right ankle. This enabled me to get rid of that brace and the waistband. In 67, I had the same operation on the left ankle and began using forearm crutches along with my brace. While I recuperated, I had a homebound teacher. The following spring, I began volunteering at the VA hospital, of which I happily took 3 buses to get there. And that summer, I got my first job at a bank. I'm still in touch with one of the technologists from the VA hospital to this day. I was never a student and struggled throughout elementary school. When I went to school, I took a commercial course, thinking I wasn't going to college, and the teachers would let me out 5 minutes early to get a head start to my next class. I was involved in many activities, including typing for the school paper, going to and helping out at dances, as well as being a member of the prom committee. In 1969, I took hand control driving lessons and passed my road test in the snow. The same year, my guidance counselor told me about a New York State vocational rehab scholarship, which gave me the opportunity to go to college anywhere in the world, providing tuition, books, and 3 round-trip tickets home each year. I chose Florida, where there was no snow and the weather is nice year-round. So after graduating high school in 1970, I packed my bags and Dad and I drove south to Florida. I attended and graduated Miami-Dade Community College in Kendall, receiving an associate in science degree in secretarial science in 1972. As I said, I was never a student, but was very happy receiving my 2-year degree. Obtaining my parents' blessings to stay in Florida, I secured a job at the college and I worked there for more than 10 years, achieving the position of office manager in the financial aid office. My not having a 4-year degree prevented me from a promotion to financial aid officer and a pay raise. I met my first husband in 1982 at a Christmas party while visiting my family in New York, and we were engaged in May in 83. Since my employer would not give me a leave of absence for a New York wedding, I resigned. We were married that October, and we had a honeymoon baby in 1984, Matthew. After the birth, I needed a new long leg brace, at which time I had a plastic one made. I could now enjoy a variety of shoes. My sister and her husband moved from Calgary to Florida that same year, and she was a big help to me. Unfortunately, 1987 brought a divorce, and for the next 17 years, I dedicated my life to bringing up my son. I was very involved in our church while doing odd home-based jobs to supplement my disability income. Very involved in my condo, serving at various times as building president, Master Association Board of Directors, Social Committee Chairperson, and newsletter editor. 1987 was the same year I attended with my 3-year-old son, my first polio support group meeting. I looked around, heard people talking about their aches and pains, and thought to myself that I don't have any aches and pains. What am I doing here? My parents moved to Kendall in 1990, followed by my older brother and his family. In February 1992, I went to Europe with my sister and brother-in-law. That August, Hurricane Andrew hit Kendall, which eventually blew us up to Boca Raton in January 1993. My family soon followed, one at a time, all residing in the same development. I found Spanish River Church, where I became involved in the singles ministry. I helped in organizing plays, shows, activities, coverage parties, and I was a greeter for Sunday Bible study class. Matthew was involved with the youth ministry and numerous sports. He achieved 42 league trophies in several sports, to which I provided transportation and was frequently the team mom. 1993, I attended my first polio support group meeting in West Palm Beach, about 30 minutes north of where I live. There, I met Carolyn DeMasi, also living in Boca, where we discussed and found a need for a support group in the South Palm Beach County area. I've always worn a long leg brace on my left leg and have utilized forearm crutches. Early in the spring of 1994, I started to experience pain in my right shoulder. I was given cortisone and PT for the pain. In the fall of that year, my mom, my sibs and I helped mom. We all took turns taking care of dad. It was during that stressful time I may have started to feel the effects of PPS. Dad died that October. In 1996, Carolyn and I co-founded the Boca Area Post-Polio Group, having monthly meetings at Spanish River Church. Newsletters began in 1997, a conference in 2000, and in 2003, we set up a yearly cruise for polio survivors and families. The cruises have attracted survivors from as far west as Hawaii and as far east as Italy, with all parts of the US and Canada being represented as well. The January 2022 cruise will be our 18th trip. In 1999, 1989, I added a short brace on my right leg when surgery on that ankle failed. I have never been able to walk without braces and crutches. Despite this, I did everything. Nothing stopped me. I walked everywhere, climbed steps, drove, had lots of home parties, went to dances, and danced. Enhancing my son's education in 1999 and 2000, we took bus tours to 5 European countries and extending our stay with family, visiting 2 more countries and visiting several Western United States national parks, respectively. And we also visited Washington, D.C. I just can't remember when my cousin gave us a private tour. He pushed me all over in a manual wheelchair. In 2001, my church offered me a donated power chair, which I gratefully accepted. It sat in my bedroom for 6 months as I did not need it, nor did I have the means of transporting it. I was anticipating surgery as I tore my right rotator cuff, so I sold my 94 Honda Accord and purchased a new Toyota Sienna van, which was customized with a power chair lift in the rear. That fall, I had the surgery. I persuaded the insurance company to allow me to stay in rehab for the full 100 days of my recovery, as my arm was in a sling, unable to weight bear. I had 2 leg braces and was unable to walk or do any activities of daily living. The power chair now came in handy in rehab and when I returned home. At our February 2004 polio meeting, Joel, a polio survivor himself, walked in, and I thought to myself, now there goes a man in command of himself. We were inseparable from then on. We married that October and used the November cruise for our honeymoon. In 2006, Matthew graduated, that's my son, with a BS in math from University of North Carolina, Wilmington. He married his wife in 2012. They had our first grandson, Dean, in 2013. After going back to pursue his master's degree, he graduated from FAU with a degree in forensic accounting in 2014. In 2015, our granddaughter, Annalise, was born, and in 2017, they all moved to the Charlotte metro area. He is currently employed at Wells Fargo as a principal auditor. During Matthew's happiness, his only grandma and my mom died in 2007. Despite being a single mom with a disability and limited income, I left no stone unturned, preventing me from providing Matthew with any and all opportunities to succeed in life. He has made me a proud mom and grandma. I do not know if I ever have been formally diagnosed with PPS, as I was still walking and only used a scooter or power chair for shopping and long distance walking. In March of 2016, Joel and I were hit head on I-95 at 65 miles an hour. Although we sustained injuries, C2 fracture and a non-displaced femur fracture on my good leg, Joel a compressed lower spine fracture. Thank God, nothing life-threatening for either of us. I spent 2.5 weeks in rehab. I do know that any type of trauma can exacerbate PPS. Since her van was destroyed, this accelerated us to purchase a used ramp van, which has been a blessing to both of us. I have not walked since April of 2016. As such, I no longer wear my braces. A benefit of using a power chair is I no longer have to worry how I will carry something. It has preserved my weakened arms and shoulders and has effectively eliminated the risk of slipping and or falling. I was diagnosed with breast cancer in late 2017 and had a lumpectomy in each breast. My friend and fellow polio survivor, Professor Mike Kossoff, strongly suggested I get a second opinion from Dr. Gil Liederman, who is a triple board certified in radiation oncology, medical oncology, and internal medicine in New York. Joel, at this point, had been managing with his prostate cancer for over 20 years. We decided to spend 6 weeks in New York with free accommodations through American Cancer Society, receiving his pioneered fractionated stereotactic body radio surgery treatment during the summer of 2018. We felt so good after our treatments that we took in all the sights and sounds that New York City has to offer. Broadway plays and visiting family. We even saw a movie star. To date, we are cancer-free. I had and still have the tendency to put weight on easily as I was not physically active and loved to eat. The doctor always told my mom, if you love her, don't feed her. And mom did not eat nothing, even if it was only a bite. To combat this, because I am no longer walking around, I exercise 30 minutes a day on my new step, which is a seated stepper, and am constantly watching my weight. Due to COVID-19 pandemic, we have been holding our polio monthly support group meetings virtually via Zoom for the past 13 months. Our world has become a bit smaller. However, we are now able to reach people who would not normally be able to attend meetings in person, as well as survivors from all over the world, where we can continue our sharing and caring together. This October, Joel and I will be married 17 beautiful years, and we do everything together as a team with lots of adventure. We so enjoy when our 4 children and 4 grandchildren visit, as 3 children live in Georgia and 1 lives in North Carolina. Through all our trials and tribulations, we have been blessed. I wouldn't have missed it for the world, and I think you all feel the same way. Thank you for the opportunity to share my story. Thank you.
Well, thank you so much.
Thank you.
Yeah, and I know my mother had told me, you know, life is what you make it. And in spite of all your polio problems and stuff, and what a nice life you've had, and how important it has been to the lives of other people, the polio survivors. So I appreciate you taking the time to tell your story to us, particularly on Mother's Day coming up, and the importance of a wonderful life in spite of handicaps. I think you are a real leader, and that's why I asked you if you'd make a little presentation to us.
Well, I appreciate that, and you're giving me goosebumps.
I think this is just wonderful. I love Zoom.
I never thought I would say I'd love Zoom, but I do. I'm really enjoying this. It's so nice to see you. Thank you, Maureen.
You're welcome. You're welcome.
Thank you.
I have a few things now. Linda Priest has, you know, she'd had a car accident and she was moved to rehab today. I just found this in the email. Had broken bones in 4 quadrants of her legs and cannot do surgery. She has soft casts on both legs, and she would love to have phone calls. And her cell is, if anybody is interested, it's 404-606-2049. Again, 404-606-2049. And there's a GoFundMe page set up, and excuse me, and you can check it out. And if you'd like to contribute to her van was totaled, so she could use all the money, you know, that you all could come up with to help her. And then I have on the email, I found a nice letter to us from Diane Camp, and she's telling us about her experience with polio. It says, "Thank you so much for responding to my email. God bless you. I live round trip to the Shepherd Center, 98 miles. I live in Dallas, Georgia. I have truly missed getting to come to the polio clinic. I think a lot of Dr. Bowden. I contacted polio when I was 3 years old, 1948. The polio affected my right side. For 12 years, I walked on my toes. Until the March of Dimes started helping me, I was sent to Georgia Warm Springs Foundation. For my surgeries, no vaccine would help me. Excuse me. God stepped in and I got help. Last time I was there was when I was 17. There were 4 months for both leg surgeries. My dad and grandfather both were Baptist preachers. When I contacted polio, the doctors at Crawford Long didn't know what was wrong with me, and I told my parents I wasn't going to make it. I was in a coma for 3 years. It says my dad and grandfather had my bed surrounded by prayer. God answered their prayers, and she's now 75. I thought that would be something, nice for us. Then I'm going to have, next month, I'm going to have for my program, it's a Christopher Brand, and he's the CEO of FODAC, and he's
There
been,
you go.
yeah, and they're in the process now of working with the Indian problem with the viruses. Isn't that something? And they're going to be, I'm not sure exactly, but all the manipulations and whatever with vaccines and if they need wheelchairs and what have you, that they'll be doing that. So that's our next program in June. And then let's see. I was trying to think if there's anything else.
Rita,
I think
Rita,
from my end, yeah.
I just wanted to make a quick announcement about what we talked about when.
Sure. Yeah, everybody can chip in now and just say whatever you want.
Okay, thank you. As you know, I've been working, some of you may know that I've been working with a small group, Kathy McIntyre, Belinda Whitaker, and Shirley. Wait a minute. Shirley Duhard Green, to on an event for Dr. Strasser. And so we're still working on that. But one of the things that we want to do is have a memory book for him. So we'll be sending out a little flyer and you'll get a formal invitation later. But if you would consider, we're going to have either a dinner or luncheon or something like that. I'm still checking some places. But if you have pictures of yourself or a letter that you would like to include, if you would send that to our mailbox, our email box, that would be wonderful. We're going to include these pictures and letters when we present it to him. So I'm just giving you a heads up ahead of time. Mark July 31st. We know a date. We're not sure of the place yet. We're still trying to lock in some place. But the date will be on the 31st. So just to hold the date in the meantime. And as we work on finalizing this over the next few weeks. So July 31st is the 5th Saturday in July, right between our 4th of July and Labor Day holidays. It's right in the middle there. So we're looking forward to this event and giving you more information about it. And you'll be hearing more about it. Belinda, is there anything else to say? Or do you want to say?
Oh, I'm making a quilt for him, and I got my panel today. So
great.
Yeah. Oh, is
If
it
there's anything that anyone wants to present to him of your own, you can do that too, because we'll collect the things and put those things together.
Well, see, I'll have this ready for you, and it'll be really from APA.
Okay, yeah, we'll have
Not just for
everything
me,
done
because
by the
I
end of.
personally don't know him. I've never been to him.
Okay, but some of you may have been to his presentations.
Yeah.
He's been a strong supporter of APA, and there's a lot of love for Dr. Strasser and his nurse Peggy. We're inviting his wife and his nurse also to the event. So we're working on it. We think it's going to be really nice. We're hoping that we have a lot of people there to wish him a happy retirement. So just wanted to give you that heads up for those in this area. And if you're not from this area and you just want to write a note to them, that's fine too. We'll include it.
Maureen would like to discuss her cruise. You know, the Florida group is going to do a cruise and she wants to invite us. So, I don't know, is she unmuted?
Yes,
Maureen?
Yeah, go ahead.
And so my travel agent, first of all, we've been cruising since 2003 was the first time we put a cruise together. Obviously, nobody's been cruising for the past 13 months. And so my travel agent informed me that several European cruises were taking place late last year, where out of 350,000 cruisers, only 50 got COVID before anyone even was vaccinated. So my son did the math for me. He said that is 1 out of every 7,000 passengers, or 0.0143%. So that sounds pretty safe to me. So as things with the cruise industry are still quite fluid, we're looking forward to cruising in January of next year. We are going to go to Cozumel, Mexico, Roatan, Honduras, Puerto Costa Maya in Mexico, as well as Royal Caribbean's private island of Coco Cay, Bahamas. And hence Stanley's virtual background there. I'm sure it will be different in adapting to a post-COVID era of cruising. If I have to wear a mask at home, why not wear one on the ship where you are entertained, wined and dined, no laundry, cooking, no food shopping, making beds, and enjoying the warm Caribbean sea breezes, etc. On the news yesterday, I heard that the CDC said that by mid-July, the cruise ships can set sail. They no longer have to have simulated testing if 98% of the crew are vaccinated and 95% of the passengers are vaccinated. And it will be up to each individual cruise lines whether they will require to see your vaccination cards. And so as we know right now, the COVID protocol will be testing, masks, and social distancing. So if you just think that you might be interested in cruising within the next 18 months, because things can only get better. So you should make a deposit now. And so in the beginning years, my travel agency invited me and a few potential cruisers on board to lunch, to tour the ship, take measurements, and capture in pictures. It was in this way I could see that the ship was accessible and to foresee any issues that could be taken care of beforehand. Polio survivors and families took comfort in that, as they could picture themselves in the stateroom, the bathroom, etc., from our website. Unfortunately, nowadays, only my husband and I are able to tour any brand new ships. I usually secure accessible land tours directly with the vendor, explaining exactly what kind of sightseeing tour we require at a fraction of the price that the ship would charge. Before we set sail, I send out about 3 emails to the cruisers with valuable information along with the roster to keep in touch with each other while on board and once they get home. So I see a few here who have cruised with us or are going to cruise. If we can see a little show of hands of those people. See, we have Stanley and Eddie and Marcy and me and Joel. And we've had Linda Priest and Sylvia Ward, and we've had David, I can't remember, David Jones, Betty Wright. So we've had a lot of, Georgians join us. And right now, we already have 32 cruisers signed up. And so would it be all right if anybody would like, if some of my cruisers, either Stan or Eddie, want to share a little bit of their cruise experience? Would that be okay, Rita?
Yeah, sure.
Okay.
Certainly.
Move up there. I don't think they can see you.
Go ahead, Eddie.
I forgot to mention Harriet. I don't go on a cruise without my wife.
That's right.
My girlfriend gets very upset.
We can see her. We can see her.
The last cruise that we went on, and I think from the picture, you can tell we're having a super duper time.
Mm-hmm.
we've always, the way everything is arranged, it's the best vacation we could have. You only have to unpack once and everything is taken care of. Your entertainment, if you like to gamble, there's a casino on the boat. There's shows every evening, and during the day, there's all kinds of activities. And if you want to do nothing, like what I do is I take my book and I go out to the back of the ship and I just sit there and read and enjoy the breeze. And it's just a wonderful way to spend the week. And the people that come by, you really are impressed with our polio people, that we really are an interesting bunch of people. And as mentioned before, you know, we've all gone through all our trials and tribulations, but we still come out on top. And I think that's a common denominator that we all have, that my philosophy has been, no matter how bad it gets, it could always be worse. And so enjoy every minute. Stanley?
Yeah, I've only been on 2 cruises. Eddie, you've been on a lot more, but I've enjoyed them tremendously. Aside from all the activities and people and things you do and as a group or with individual people that you meet on the cruise, I just find the group is a wonderful group. We get together every night for dinner, and that's when we get to share our plans for the next day or for the evening, and do it either in a smaller group or larger group. And it's just wonderful. As wonderful as I find Zoom is to get to know people who have been in my shoes and whose shoes I've been in, being right face to face and be able to be with them and spend some time with them is just the most wonderful experience. And I'm looking forward to it very much. And the backgrounds that you've seen me flash today are the ships that are pictures of the ship that we're going to be on in January. It's called the Allure of the Seas, and it looks like a wonderful ship. It's a very large ship. It's got a lot of tremendous amenities, but as I say, the thing that is most important to me is the camaraderie of the group, within the group and of the whole group.
Thank you guys. Does anyone have any questions about cruising at all? Okay.
Anybody else have anything you want to bring up? Any comments or anything you want us to know about?
Rita, you were talking about that person who was in Warm Springs in 1948.
Yeah, Diane Camp. She sent an email. I don't know why she did it, but I had responded to an email to her, and then she just, I guess it made her feel better when, you know,